Told us about the CAR T-cell therapy. Literally, myself and my husband were confused during the start. But later they explained as Raja sir and Ravi sir gave us a brief explanation about the CAR T-cell. I was literally worried how will I be there inside the room for about 40 days, and so many questions were there. I was not confused about the treatment because I know Apollo is going to give me the best treatment. And Radha sir told me it's not going to be painful, and all that was true. It wasn't painful. And once I was into the BMT, the sisters and the doctors who were there made me feel like my home. They were there 24 hours available, and they even offered me my favorite food salon. So thank you for the team, and I literally want to thank Raja sir and Ravi sir for choosing me into this CAR T-cell therapy.
6 సంవత్సరాలు ఇప్పుడు నేను నెల్లూరు చేస్తున్నాను. నాకు 2020 జనవరి 23వ తారీఖున ఊపిరితిత్తులో నీరు వచ్చింది. నీరు వస్తే నేను నెల్లూరులో ఒక హాస్పిటల్కి వెళ్ళాను. ఉన్నారు మళ్ళీ చెన్నై అపోలో చెన్నై అపోలో క్యాన్సర్ హాస్పిటల్ అని చెప్పారు. మేము క్యాన్సర్ హాస్పిటల్ డిసైడ్ చేస్తున్నాము. క్యాన్సర్ హాస్పిటల్ కూడా మా బంధువులు రాజస్థాన్ బాగా చూస్తారని చెప్పారు. ఇచ్చినప్పుడు హెల్త్ పరంగా చాలా వీక్ అయిపోయాను. ఎదురులోకి పోయి కళ్ళమాటి పోయి వాడికి ఇబ్బంది పడ్డాను. తర్వాత సార్ వచ్చేసి నవంబర్లో కార్డియోథెరపీ ట్రీట్మెంట్ స్టార్ట్ చేశారు సారు. ఇది డిసెంబర్ 31వ తారీఖు డిసైడ్ చేశారు. ఆంటీ ఇచ్చి ఇక్కడ అపోలో హాస్పిటల్లో కార్లు కానీ నర్సులు కానీ అందరిలో చాలా బాగా చూసుకొని ట్రీట్మెంట్ చాలా బాగా ఇచ్చారు. బాగా ఇచ్చిన తర్వాత నేను హ్యాపీగా ఆ ట్రీట్మెంట్ అయిన తర్వాత మళ్ళీ నేను నార్మల్ మనిషిగా అయ్యి నార్మల్గా ఉన్నాను. నాకు ఆ టిమోలు ఇచ్చినప్పుడు చాలా వీక్ అయ్యాను.
So I'm a pediatric hematologist. What I'm going to say today is that with the CAR T, what is a CAR T? Because has very nicely explained what is a CAR T, right? But it's a living drug, and what we are doing is exploiting Mother Nature. For billions of years evolution, we already have anti-cancer immune system, and one of these cells are the T lymphocytes, which we are now cleverly genetically engineering it. So all we do is collect the cells from the patient and genetically engineer them and infuse it, and actually very little treatment, and these cells will stay in the system. They will do the job and kill the leukemia cells and the cancer cells, and they stay in immune surveillance so that whenever the cancer comes in, it will be effective. Now, is it 100% effective, 100% cure? No. But from those patients, those children and adults with particular type of leukemia, they had no hope of survival. From 2012, the first child with acute lymphoblastic leukemia had the CAR T cell called Emily Whitehead, and she became a poster child, which is still alive. From no hope, she's been now cured more than 10 years. So the question is, what are the long-term cure rates for this type of CAR T cell therapy? So what I can tell you, the first trial which was done in the multi-center trial, multi-country trial, Iliana trial, which is used in children at less than 25 years of age with relapsed refractory B-cell acute lymphoblastic leukemia. So remember, it's a B cell, which is any cancer which is expressing a antigen, as Vivasha showed, called CD19. So this T cells we have can attack any cells which is expressing that CD19 antigen on the cancer cells. So it's mainly at the moment for B acute lymphoblastic leukemia, which is mostly in children, and lymphoma, children and adults. So we then infuse these cells, and the results showed up to 50% are now surviving. So remember, these are the patients who has not been cured by any other treatment, and many of them are post-stem cell transplant relapses. So, and they had this drug, and up to 50% of them got cured. It's not too toxic, really. Of course, and this field is just evolving very further. And from the CAR T cells, science is moving on to different other immune cells, as I mentioned, to pull this chimeric antigen receptor, but to make a T cell which was not able to kill the leukemia cells and the cancer cells before. Now this is what the technology is now available, and we can offer it for the leukemia, lymphoma patients who are CD19. But currently, the product we have is approved for 15 years and above, and we give the CAR T cell therapy too. So overall, things at the moment, the long-term results coming in pediatric and be in adults in the leukemia and lymphoma, roughly at about 50% cure rates. But there are efforts, and soon you will see many other products will come, which will try and improve these outcomes. And at the moment, it seems it's being used in those relapsed refractory who have no hope. But efforts are ongoing, trials are ongoing abroad, and soon they will come to India also. That will bring it much more forefront. We'll bring it much earlier. So just watch the space and wait for development. But I think at Apollo we are quite in the cutting edge of the technology, and we at least have been able to launch this project for CAR T cell therapy, and we offer this treatment. There are patients who are going abroad for this treatment, and end up having paid huge money, and this is something called indigenous CAR T, and we are at the cutting edge of the development. So learn, hold, wait. We are going to offer this treatment, and we can. The ultimate idea is to make a difference to many patients, many children and adults with this relapsed refractory leukemia lymphoma, which cannot be cured. To actually offer them a cure. Thank you so much.
Thank you, Dr. Rajat. So we have came a long way, but I think the road is far long to go.